Centro de la Familia has been working to overcome language and other barriers to get free virus testing and important information related to COVID-19 to Latino families in rural Utah. ABC4's Jordan Verdadero visited their location in Providence.
Bianca Cruz is a family service specialist for Centro de la Familia in Providence.
We have some parents that are not working.
She says the Latino community here has seen constant growth.
We are a migrant seasonal Head Start, and we have a lot of workers who work in the farms.
Cruz says she noticed a trend within the Latino community of some being afraid to go to the doctors or government-run agencies because of their immigration status.
Our agency partnered up with the Utah Health Department, and we got them free COVID testing.
Cruz says they tested 133 people in the Latino community in just one day, and they're helping to educate the community about the pandemic.
We understand that there's some parents that depend on this in our care and our resources that we give them.
Cruz says the nonprofit had to delay their opening because of the pandemic, which has presented other challenges as well.
We did a lot of services remotely since we weren't able to do it in person, and we're only allowed to have certain amount of children.
That's why Cruz says the agency is prioritizing Latino families who work in agriculture and low-income families before others during the pandemic.
We had a point criteria, and the most points that the children had, those are the ones that we're serving first.
For more information, you can go to abc4.com. Reporting in Providence, I'm Jordan Verdadero, ABC4 News.
Joining us now from our ABC4 backyard studio to continue the discussion on a positive path forward, we have Gonzalo Palza. He is the CEO and Head Start Director of Centro de la Familia, Utah. Mr. Palza, thank you so much for joining us. Let's talk about the specific needs of the communities that you serve in regards to this pandemic. Is there enough testing, enough education, affordable health care availability? Talk about the struggles there.
Yes, thank you for having us, Emily. We actually opened our centers the 4th of May, and we're serving about 20% of our enrolled capacity because of the guidelines that we have from the state and the CDC for social distancing, etc. And we have tried to get every single staff member and every single child tested before they could come to our centers. That was the biggest challenge we found. We found that the testing was not available for them. They had to have doctor's orders. There were just barriers to testing. So we worked with the health department to bring testing to our centers, which worked quite well actually. And we were able not only to test our staff and our parents, the parents of our children, but also the community around our centers as well.
Now,
that worked pretty well.
I'd love to hear that. You guys made it happen. So what are some of the concerns you're hearing from the people you serve? What are their worries?
Currently, of course, there is a spike in the pandemic near our area of service as well, particularly in Providence, Hiram, the JBC plant in particular. They had a big spike a while ago, and we were able to know about that spike before it actually became news. So we closed our center preventively for 2 weeks because of it. Many of the parents and families that have our children that have the children in our centers, they are working at JBC. So it's because of those situations where their exposure is not known to the community until too late, that they're fearful about coming to their centers and bringing their children to our centers. It's the exposure that they don't know about. So testing is probably the best way to go.
Now let's talk about how your organization helps and what you do every single day there at your location. Talk to us about the services that you're offering and the kids that you're working with.
Well, we are grantees from the federal government for Head Start, particular migrant Head Start, and we serve our children comprehensively with health, education, family services, about 6 to 8 hours a day. We offer transportation, we offer curriculum, guided development in classrooms by age groups, and we work very closely with the parents because the children are from 0 to 5-year-olds. We can't do much to them and for them if parents are not engaged. So one of the core competencies of Centro is parent engagement, and I think we're pretty good at that.
I think you're very good at that. I think you're being a little too humble. Aside from language, what are some of the other barriers that you're working to overcome?
Access to regular services from the community. Unfortunately, some of our parents are not documented. Their children are U.S. citizens, and so those parents are not eligible for some of the services that everyone else is. And therefore, and by extension, unfortunately, some of their children aren't either. So that's one of the biggest barriers that our families are facing currently. Even though they are part of the essential chain of food, they're working in the fields every day, and they're producing everything that we consume at home, just about on the table. So that's one of the biggest concerns that I would say.
And essential, I like to use that word because they definitely are essential to keeping these businesses and our lives going. For the people who might be afraid to seek resources, what is your message and your advice to them? There is help out there, but some are afraid to get it. So what is your message to those people?
There are organizations in the communities like ours who have earned the trust of the community. We're not the only ones. There are many of them, and they should approach those organizations who will work with them to achieve and to reach those services that they really desperately need. So they need to contact the organizations that they trust, such as ours and others in the community, and they will work together to get their services as they need them. It's all about their children, however, so parents are there because they are working for their children, and they deserve access to everything else like everybody else.
Now, Mr. Palza, thank you so much for joining us. Thank you for all that your center is doing to help all of the children there. Such an important resource for so many important communities in our state. For more information on Centro de la Familia, you can go to their website, which you can get to from ours, abc4.com. Thank you so much for joining us today. We really appreciate it.
Thank you, Emily.